Today's lecture is regarding the diabetes mellitus. Diabetes mellitus is a basically metabolically syndrome, and we're going to discuss the definitions along with its types, and we're going to detail the pathophysiology that is underlying the major types of diabetes mellitus in this lecture. Now, in simple words, diabetes mellitus in layman language is also known sugar diabetes. Now, to get the core knowledge of diabetes mellitus is basically when the body not use glucose normally. Glucose is basically the main major source of energy from the body's cell, and when it is not utilized in a proper way, the person can basically suffer from hyperglycemia, and this word is basically indicating the increased amounts of glucose that are running in body. But we all knows that your past exams and to score good in exams, it's always very important to define the medical terms in a proper way. So, by the definition of diabetes mellitus is a group of metabolical disease characterized by hyperglycemia resulting from defects in insulin secretion such as insulin action or both. The pathophysiology, which is basically affecting the secretion as well as the action of insulin, they can affect the glucose level in a person. So I was just wondering where the word diabetes came from, and I found the diabetes mellitus is derived from Greek word diabetes meaning siphon, which means flow through or a pass through, and the Latin words mellitus means honeyed or sweet. So this is quite interesting when you relate the medical terms from with their origin. This is because in diabetes excess sugar is found in blood as well as in the urine. So it is very important for you people to remember this fact that diabetes can be diagnosed the blood glucose level as well as the glucose level in urine. This is how it get its particular name as well. So it is quite interesting to know. If you look at pancreas as an organ, it is important in abdomen, almost in the left upper quadrant. It has exocrine as well as endocrine functions. The exocrine function is to release the pancreatic juice for the purpose of digestion, and the endocrine function is to release different hormone, majorly the insulin, and we have some other hormones as much as somatostatin and glucagon and gastrin, and also release the endocrine portion of pancreas. If you look closely, features of pancreas, we have the islets of the Langerhans, that is basically the islands of cells that are surrounding by the spotted cells from all the other sides. Now we have, if we studied the islets of Langerhans in details, you can see of here that we have the alpha cells and delta cells, and also we have beta cells, and primarily the most importantly we have the beta cells located in the islets of Langerhans. Now each beta cells are basically responsible for the release of insulin, and insulin, we all know that the major modulator that is required for the control of glucose in our bodies. And we're going to study the major function of insulin and how does it basically affect the glucose metabolism. But we have to remember and the fate of insulin is to enter the portal circulation, and it is going to majority the effect, and it is going to majorly the effect of metabolism of glucose inside the liver. So for now, focus on these facts that insulin is getting released the beta cells from the pancreatic islets and often secretion the portal circulation and is carried to portal vein, which is prime target organ. Now insulin has two major actions to perform in the fasting stage as well as the post-prandial state, which is going to differ quite. In fasting state, insulin secretion is low and it mainly act as hepatic hormone and modulate glucose production. Post-prandial state, insulin concentration are high and then suppress the glucose production from the liver and promote entry of glucose to peripheral tissues. So remember these two major primary action of insulin and how is going to differ in his actions in different states. So this is quite intelligent enough to know how it is going to act in different scenario. So for now we are done with different actions of the insulin, and now we are going to move forward. What is going to wrong in these particular actions of the insulin that is going to ultimately results in diabetes mellitus in these particular patients. So thanks for watching and also subscribe my YouTube channel.